Good afternoon and welcome to the Multi-Ministerial Task Force Doorstop interview. On our panel today, we have Minister Lawrence Wong, Minister Ong Ye Kung, and Director of Medical Services, Professor Kenneth Mang. May I now invite them to begin with a few words. Minister, please.
Hi, afternoon. Today is a doorstop, but a sit-down doorstop. So it's a shorter session. Just want to report a few things. So for me, I want to report on the vaccination progress. So as of 6 July, which is today, total doses administered is 5.9 million under our national vaccination program. But these days, we report this number every day. More than 3.7 million people have received first dose of COVID-19 vaccine. 3.7 million is a little bit of a magic number, almost. 65 point something %. So I would say by end of today, 2/3 of our population would have their first dose, So as you remember, during PM's, the Prime Minister's broadcast, 31st May, I believe, he set the target that 2/3 of our population should have their first dose in early July. So end of today, we'll achieve that target. And what it means is that once 2/3 have their first dose, a few weeks later, 2/3 will have their second dose. So we are on track to achieve 2/3 of our population fully vaccinated. And I think we can go further. I will explain later. As of now, 2.1 million or 39% of our population have received 2 doses. And on average, we are now vaccinating 76,000 individuals per day. Our target, our total capacity is 80,000 or so. So actually, we have capacity to vaccinate more. So we do need more people to come forward and get vaccinated. Let me give a breakdown by age groups. And this age group, I'm going to give you percentages of those who have received at least 1 dose or book an appointment. So long as they turn up for their appointment, they will also get vaccinated first dose followed by second dose. So these numbers that I'm giving you are potentially the proportion of our population that can be vaccinated. Yeah. So seniors above 70 years old is now 71%. I think the last time I sat here, the update was 69%. So this group is really quite asymptotical, quite saturated, but we managed to push up by 2 percentage points. Yeah. 60 to 69 years old, 85%. 50 to 59 years old, 86%. 40 to 49 years old, 86%. 30 to 39 years old, 78%. 20 to 29 years old, 80%, and 12 to 19 years old, 80%. So I'm focusing on these numbers because I think eventually they'll all convert to first dose and second doses. And potentially, if you look at the numbers, they're all hovering about 80, except for the seniors above 70 years old, which means I think we can realistically expect our population eventually to reach this level of vaccination, about 80% or so, if all these numbers come true. But what we really need to do is to get more of our seniors vaccinated. You compare across the ages, those above 70 has the lowest first dose and booking rates. It really should be the other way around. We really ought to have them have the highest percentage. We all know they are most vulnerable. And what we have observed in countries with high vaccination rate and have opened up, such as the UK, Israel, US, for example, you do see infections gone up. Infections gone up mostly amongst young people because they are up and about and less vaccinated. But hospitalization and severe illnesses, quite stable, but mostly amongst the old still. Yeah, so I think for countries that have opened up, it does show that those who fall severely ill are still the elderly and the seniors. And the reason is because when high vaccination rules are relaxed, society open up, people move around. and then the old are more likely to be infected as a result. So it's not a matter of the elderly saying that, no, I don't go out, and therefore, no, I'm safe. It's not that at all, because these days when we look at our infections and our cases, many of our infections have actually occurred at home. So it's not really a matter of not going out. Yeah, when society open up, your family members go out and can bring the virus back home. So the seniors must get vaccinated. We will be making a bigger push to reach out to our seniors, knocking on their doors if necessary, and this is the work that we need to do. So any one of us, we know of an elderly, a neighbor or a relative who is still hesitating, please help reach out to them and persuade them. Show them our videos in various languages. Just a short update on vaccine efficacy from data from Singapore. I've been updating this, but data has been further refreshed. In particular, NCID and MOH, they have recently concluded a study of about 1,000 household contacts of COVID cases between September 2020 and end of May 2021. And using their data, they found that effectiveness of vaccination against the Delta variant, regardless of symptoms, is about 69%. So this is effectiveness of protection against infection, 69%. So this is quite consistent with other international observations. Recently, there's a reported figure from Israel that Pfizer vaccine efficacy against infection is 64%. So ours registered at 69, so it's roughly that. And this data will be submitted for international publication. It's Singapore's contribution to the understanding of the Delta variant and the vaccines. As for protection against severe illnesses, our data show that protection against symptomatic disease is between 80 and 90%. Effectiveness of vaccination against severe COVID disease requiring oxygen supplementation, ICU care, or death is at 93%. So amongst the local cases reported since 11th of April, only 1% of those vaccinated require oxygen, and none were admitted to ICU. Compared to the unvaccinated cases who develop severe illnesses, the percentage is 10%. Yeah, so it's 1% versus 10%. Now, this is an important point next. With 2/3 of our population now having done the first dose, I think in the coming days or 1 or 2 weeks, we will pretty much saturate our coverage of first doses, and which means our objective of covering or giving as many of our people as possible good protection, that objective would have been achieved. So we will now have to urge individuals to rebook your second dose appointments earlier, because your second dose appointment might be in August. Rebook them earlier so that the interval between first and second doses is 4 weeks instead of 6 to 8 weeks. We are not constrained by supplies anymore, and in fact, we have capacity to deliver more dosages. So remember, the earlier you can get your 2 doses, the better the protection against severe illnesses. A UK study recently showed, a recent UK study showed that against the Delta variant, vaccine protection from symptomatic disease is 35% if it's 1 dose, 79% if it's 2 doses. So get your 2 doses, you'll get better protection earlier. We have been sending out SMSs to those with later appointments to ask them to move forward. 131,000 have moved forward their appointments. There's another 200,000 or so outstanding. We hope they will rebook soon. So help us reach out to them and ask them to rebook their appointments, get themselves protected early. All eligible individuals in Singapore are now already offered vaccination. Everyone has been offered, so long as you are eligible. So at current rate of vaccination, we expect 50% of our population to have received 2 doses of vaccines around the week of 26 July, that means around the starting of the 4th week of July, we would have achieved 50% of our population having received 2 doses. By then, that is an important milestone, and I think we can open up even further. And with good vaccine coverage, from a public health point of view, we can also allow the vaccinated individuals to participate in more community and economic activities once we reach that 50% mark, because they are less likely to be infected and therefore less likely also to cause disease transmission. So, and it is also better if you are not vaccinated, unvaccinated, not to be part of such larger gatherings in order to better protect yourselves. So we are planning for vaccinated individuals, when we reach the 50% milestone, to be able to dine in bigger groups and to take part in bigger events if they are all vaccinated. And that includes participating in events, settings such as religious services. So Minister Lawrence Wong will speak about this in greater detail in a short while. And also when we reach 50% milestone, 50% 2 doses milestone, it will also be timely for us to have a more definitive roadmap. As of now, I think our coverage is still close to 40% 2 doses, so I think we are still cautious. But once we reach 50%, it will be timely for us to have a more definitive roadmap to transit towards endemic COVID. The transition, you know our style, will never be a big bang. Our approach is always do in steps, do in phases, in a safe, in a cautious way. Yeah, and it will not just be about SMM measures, not about safe management measures, as the co-chairs have explained in the article that was published last week. It must cover other aspects, such as our health protocols, how we report cases, what are the travel arrangements, overseas travel arrangements. So the MTF is working on this, and details will be announced when ready. Okay, I will now pass the floor over to Minister Lawrence Wong.
Thank you. Good afternoon. Let me start by thanking everyone once again for your cooperation during the period of heightened alert. Through our combined efforts, we have been able to bring the infection under control. And importantly, we have made very good progress in our vaccination program, as you heard just now. So we can now proceed with the next stage of our reopening. In particular, with effect from 12th of July, groups of up to 5 persons will be able to dine in at F&B establishments. Wedding receptions will also resume on the basis that if you have a group size of up to 250 persons, then you will need pre-event testing. If it's up to 50 persons, then the pre-event testing will only need to apply for the wedding party. Likewise, indoor high-intensity activities like in the gyms and fitness centers without mask on, the group sizes of 5 persons will now apply, and you can have an overall class of up to 50 persons or the capacity limit of the venue, whichever is lower. At workplaces, work from home remains the default, but social gatherings at workplaces will be allowed subject to the group size of 5 persons in line with the broader prevailing community rules. Effectively, we are going up to 5 persons across the board, and that will apply on 12th of July. We had earlier also rolled out a new regime of testing for staff working in higher risk settings like F&B, personal care services, gyms and fitness centers. We called this the fast and easy test using antigen rapid test kits. Over the past few weeks, we have onboarded companies, businesses onto this new regime, and we have put many of the systems and processes in place. So with effect from 15th of July, this new regime of fast and easy testing will be made mandatory for all the staff who are working in these higher risk settings, particularly dining in, F&B, personal care services, gyms and fitness studios. Beyond 12th of July, as Minister Ong said just now, as our vaccination coverage continues to increase, we will look at differentiated measures, differentiated safe management measures for vaccinated persons. And as explained, there is a good public health basis for this, because if you have been vaccinated, you get good protection against the infection and against severe illness. And therefore, you don't need to have such strict measures applied to a vaccinated person or to groups of vaccinated persons. But if you are not vaccinated, then obviously you will not benefit from the protection of the vaccine, and you will therefore require a set of tighter safe management measures to keep yourself safe. So what are we looking at? Basically, if the overall situation remains stable, and when we reach 50% of the population in Singapore being fully vaccinated, which we should get there by around end July, we will consider the following measures. 1, for activities and venues like cinemas, religious services, MICE events, live performances, spectator sports and wedding solemnizations, we could have a doubling in the group size if they are attended by fully vaccinated persons. So if a religious service attended entirely by fully vaccinated persons, instead of a 250 person limit, we could double it to 500 persons. For higher risk indoor mask-off activities like F&B dining, we could differentiate the guidelines so that a group size of up to 8 persons can be allowed for fully vaccinated persons. Otherwise, the group size will remain at 5 persons. Work from home will continue, but we can allow more to return to the workplace based on the percentage of the total employees who are fully vaccinated. So these are 3 aspects where we will consider having differentiated safe management guidelines for vaccinated persons come the end of July, when we reach half of our population being fully vaccinated. Obviously, there are still details to be worked out. For example, there are still unvaccinated persons, and there are also people who are not eligible for the mRNA vaccines, including children. So we will have to work out what guidelines might apply for these groups of people. We will work through these details, and we will announce the new measures nearer the implementation date. But we wanted to share with everyone now to give a sense of what you can expect in the coming weeks. All this is part of the broader roadmap that we are working out, and which we will also share as part of our reopening and as part of our transition towards a scenario of endemic COVID. And that roadmap will cover local measures within Singapore as well as travel-related measures. We hope all of this will once again encourage everyone to take up the vaccination or to bring forward your appointments and get vaccinated earlier. And as we see our vaccination coverage and our vaccination rates continue to rise steadily over the coming weeks and months, we will be able to proceed confidently with our reopening plans. Thank you.
Thank you, Ministers. We will now begin the Q&A segment. Dear members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to 1 question per media only. If you are called upon, you will be prompted to unmute yourself, so please do so accordingly. May we have the first question from Timothy Goh, ST.
Thank you, Ministers. GMS. Now, we understand that those who took Sinovac aren't counted in the national count. But given that we're relying on hitting specific vaccination levels to ease measures, this means that about some 17,000 people will never contribute to our vaccination target. Why are we excluding this group from our national count? Simply because the vaccine is not part of the national vaccination scheme. And why will those who have taken Sinovac not be allowed to take part in the perks offered to fully vaccinated people? Thank you.
Thank you very much, Timothy, for the question. I'll start off by talking about the counts. Actually, we do track all who receive Sinovac vaccinations in Singapore. The clinics that we have allowed and licensed to provide vaccination using the Sinovac vaccine report details of those who've gotten vaccinated, and therefore we do have a count. But we have not attempted to conflate the reporting that we've done by only reporting those that are vaccinated with vaccines under the National Vaccination Program, so as to better reflect the efforts we're taking within our National Vaccination Program to get the population vaccinated and to achieve the milestones. At an opportune moment when the numbers build up, we may give you a sense in terms of the numbers who also have been vaccinated using the Sinovac vaccine. But at this time, our focus remains on the PSA-recognized vaccines that we are using. Also, we still have little data concerning the efficacy of the Sinovac vaccine, specifically against the variants of concern that currently that we are currently seeing, and that's particularly the Delta variant. Whereas in the other vaccines that we're using, the mRNA vaccines, there's a little bit more data available at this point in time concerning the vaccine efficacy against the Delta variant. And this is partly the reason why we've chosen in our milestones to rely on the more tested vaccines which we have sufficient evidence that there is a good amount of protection from that vaccination, and use that for our data when it comes to achieving the targets that we have.
Yeah, maybe I just add a few points. One is that I do know that many of individuals who can't take mRNA or not comfortable, they come forward to take Sinovac vaccine, and they too are contributing to the resilience of our society. So I also want to thank them for taking this step. But as DMS mentioned, unfortunately, when we consult the experts, there's just not enough data to show how effective is Sinovac against Delta. Because Sinovac is well used in, say, China, but they have not really experienced Delta. It is being used in places like UAE, Indonesia, that is now experiencing Delta variant, but data is not coming out from these places as well. So really, we don't really have a medical or scientific basis having the data now to establish how effective Sinovac is in terms of infection and severe illnesses on Delta. But I hope this data will emerge soon and allow us to make an assessment, or allow the experts to make an assessment. The third important point is this: notwithstanding this, when we reach 50% vaccine coverage, 2 doses, I think we need to still differentiate. But once we reach a higher level, even higher level of vaccine coverage, we will have stronger herd protection, which means this vaccine effectiveness may be less of a factor. And therefore, in time, we should be able to also be more inclusive in allowing vaccinated people or some partially vaccinated or unvaccinated people to participate in bigger events. So our herd protection is also a major factor. Yeah.
Thank you, DMS and Minister Ong. Can we have the next question from Kang Wei, Zhao Bao?
Hi, good afternoon, Minister and DMS. So basically, recently there have been the case about the 16-year-old who have cardiac arrest symptom after receiving the first dose of Pfizer vaccine. So we want to check whether there's any update in the investigation, whether it's linked to the vaccine, and if there's any other further action that will be taken after this.
Thank you very much for that question. We are concerned about the case that had occurred over the last weekend, and we continue to keep a close watch on developments. The hospital looking after the boy is doing its utmost to provide the best of care, and they've been keeping the family updated regularly about what they're doing. At this point in time, the information we have is that he suffered from an out-of-hospital cardiac arrest, and this was after an episode of severe or strenuous physical activity in the gym. He had been lifting a weight that was nearly twice his body weight. So that is in fact quite an exceptional activity to undertake in the gym. And he had been also taking some supplements. We don't actually know what the actual cause is for his out-of-hospital cardiac arrest. The specialists in the hospital are keeping their eyes open into all the various possibilities, and it is indeed one of the possibilities that this might be due to an inflammation of the heart muscle, a myocarditis. It could be possibly related to the vaccinations, but this is one of several possibilities that they are chasing. I understand that they have not got the further information from some of the tests that they're doing. Some of the tests take time, for example, analyzing the supplements to determine whether this might be contributory to the boy's unfortunate cardiac arrest. At this point in time, our hearts are with the boy, but we continue to trust that the doctors will provide good and appropriate care to look after him. The expert committee on COVID-19 vaccinations has taken into account HSA's review completed recently and before this particular event, and at that time they had already determined that there was an increasing signal of myocarditis occurring amongst younger people. I think they've now reported 12 cases that they've received. And they've noticed for the first time, compared to the earlier data, the earlier signal, that some of these cases of myocarditis are also occurring after that first vaccination. And this is why the expert committee, reviewing the data and also acknowledging this recent case, have recommended a change in our policies for vaccination and have now recommended that after any dose of vaccination, people who are undergoing vaccination, particularly those who are younger and adolescents, to avoid strenuous physical activity for at least 1 week following that vaccination. And this would be for both the first vaccination as well as the second vaccination dose. Doctors have been advised also to keep a close watch on all who present to them with chest pain, breathlessness, abnormal heart rates, and to investigate and exclude this possibility that indeed these people might have myocarditis after vaccination. However, looking at the data, the expert committee, in conjunction with HSA, they've also looked at the emerging evidence from other countries, and it is still their considered opinion based on the risk-benefit assessment that it is still beneficial for vaccinations to be offered to all who are eligible for vaccination. And the ministry therefore has accepted those recommendations and continue to provide vaccinations while awaiting further information to come in from either local or overseas sources, and for further information also about this 16-year-old boy's case.
So just a very short addition. I know that the media and the public will be very curious what is the cause of this cardiac arrest of this boy. But as of now, the hospital and MOH, our key priority is the well-being of the child. Yeah, so I think let's focus on that. I think in time to come, the causes, investigations, results will come out in time to come. And in the meantime, follow the safety precaution that DMS has talked about.
Thank you, DMS and Minister Ong. Just a gentle reminder to members of media to keep to one question per media only. With that, we'll have the third question from Chen Lin, Reuters.
Hi, good afternoon, ministers. So for those who already received Sinovac, would they be allowed to receive Pfizer or Moderna under the National Vaccination Program if they regretted their choice? And why do you think Sinovac has an overwhelming response in Singapore? Thank you.
I'll ask DMS to talk about your first question. I don't think it's overwhelming per se. It's because of supply demand. I think we started off with a certain number of clinics. The clinic started with a very cautious operation. So queues build up, and so certain images show that there's long queues. But doesn't mean overwhelming. I think we have a good number of people come up. And we are slowly clearing the queue as we speak. So let me ask DMS to answer the first part of your question.
Yes, indeed. When we looked at those who had registered to take the Sinovac vaccine, we understood that in the first few days there was a there was an interest among many who had been waiting perhaps for the Sinovac vaccine to be made available. But since then, the registration rates, in fact, have started to slow down and level off. So I think whatever demand is, that has expressed itself, and it's not necessarily a case where this is an overwhelming demand. Certainly, there are a lot more people who are making registrations for the Pfizer, BioNTech, and Moderna vaccines than there are for the Sinovac vaccines even now. We have looked at the possibility that there might be individuals who had taken the Sinovac vaccine, whether one dose or more. Some might be dosed locally, but there might also be those who come from overseas, returning Singaporeans who had received a dose of a different vaccine and now come to Singapore asking us whether they can get vaccinated with the vaccines that we provide under the National Vaccination Program. We have not stopped them, although the data is still lacking concerning what the effectiveness is of this strategy using two different vaccines. We call this a heterologous vaccination strategy. And there are some theoretical benefits that may suggest that they would get good results, but there isn't much data available, real-world data available to confirm this. But nonetheless, if there are those who are eligible to receive the vaccinations from our National Vaccination Program, we will allow them to register, but we will advise them about the fact that the evidence is not available concerning how well they respond if they had received other vaccines before, and it becomes a situation where these individuals weigh the pros and cons and agree to proceed forward. But we are not stopping them from registering, and we continue to accept them for our vaccination programs under the national strategy.
Thank you, Minister Ong and DMS. We'll take the next question from Feli's Wall Street Journal.
Hello. Once COVID-19 is considered fully endemic, what do you anticipate would be a normal or acceptable fatality rate? Or do you think that this is a disease that, if it's handled properly, shouldn't be deadly at all?
There isn't much data at this point in time concerning what the situation will be. And of course, all of us within the COVID task force hope that in a situation where the majority of our population are vaccinated, we would see no fatalities, but we are also quite pragmatic, and we do accept that there may be vulnerable individuals who get infected, who may have other medical problems, and who are already much weaker compared to others. And for them, the risk of an adverse event and the risk of a bad outcome, including death, is always present. Our experience with infections, particularly with the Delta variant, amongst those who had vaccinations and those who did not, has been that those so far who have been vaccinated and had infections have all been either mildly symptomatic or asymptomatic, and therefore it's reasonable to expect that within the vaccinated group, the chances of having an excellent outcome is very high. But given that you may have a mixed group of people in this category, including those who already are frail with severe other concomitant medical conditions, one would never be complacent to say that there will never be any bad outcomes in this group of people. However, in those who have required oxygen supplementation and in those currently in our ICU, they're all unvaccinated people. So we continue to expect that as long as we will have some proportion of our population who are not vaccinated, we would still safeguard our hospital resources and expect that for some of these individuals, we will still have to extend the best of care because they are ill and they may have a severe outcome.
I just wanted to add that I think there are already indicators and signs from countries with very high vaccination rates that it may well be possible to make COVID-19 more like influenza in terms of morbidity and mortality, provided you have high vaccine coverage, especially amongst the vulnerable population, which means the seniors. There are indicators from countries that have achieved that kind of vaccination coverage. So this is why we think that it is possible that we could enter into a scenario like that of endemic COVID, and where SARS-CoV-2 is treated more like influenza, and we will be able to, get on with our lives normally. And we are therefore preparing this roadmap towards this transition of a new scenario.
Thank you, DMS and Minister Wong. We will have the next question from Po Ling, Channel 8 TV News.
Hi, Ministers and DMS, calling from Channel 8 News here. For the differentiated SMS for vaccinated person around end July, right? You mentioned that group sizes may increase to 8. Am I right to say that all these 8 people have to be fully vaccinated? So what happens if it's a household of 8 that wants to dine out? If the grandfather is not vaccinated, does it mean that he won't be able to join the family? Yeah, would appreciate if you can get a response in Chinese as well.
Minister Lawrence Wong will answer in English and I'll do the translation.
Yes, excellent. We are mindful that there will be households who want to go out to dine in a group of 8, and within that household there may be people who are not vaccinated by choice or because of contraindications, or maybe they are children and therefore not eligible for vaccination. And that's why, as I mentioned earlier, we will work out some guidelines around this. For example, it may well be that some of them may have to go for a pre-event test before they can participate in that group of 8 or in that larger gathering. Or we may very well allow some exemptions for children, but up to a cap, because from a public health basis, the assessment is that for children, the risk of severe illness is much lower. So those are the detailed guidelines which I mentioned we are still working out, and when we are ready, we will announce all of these details.
用华语回答一下。我们觉得在七月底的时候，就7月的最后一个星期啊，我们会达到大概50%的我们的人口呢，会已经接种了2支疫苗。到时候我们觉得在这样的情况下，就可以让那些已经完全接种疫苗的人士呢，能够参与比较大型的一些活动。所以好像去教堂啦，去庙啦，去好像去聚会啊，或者结婚晚宴啊，可能就可以比较有大型的这种场面，不止250个人，可以增加到500个人，但是全部的500个人需要已经接种2支疫苗。同时呢，也是在堂食的时候，可能可以增加到8个人一起进行堂食，但是8个人都需要接种2支疫苗。当然就是所提出来的这个问题就是小孩子怎么样那些没有接种疫苗的怎么样？我们觉得在还没有接种疫苗呢，参加这样比较大型的这种聚会，其实对他们的保护也不好。从一个公共卫生的角度，接种了疫苗比较难得到染上这个冠状病毒，也比较难，也比较不会传给别人。但是如果你还没有接种疫苗的话，你这个风险就高了，对自己也不好，对别人也不好。所以这样的大的场面，从一个公共卫生的角度来看，应该是接种疫苗的人才可以参与。即使让小孩子怎样？当然小孩子不能留在家，大家全家人出去吃饭嘛。所以而且小孩子，我们的专家也研究过，世界各地也经验过。小孩子通常比较不会染上这个病，而且染上了不会有比较严重的症状，也不会比较传给别人。所以我们要根据我们的这些数字呢，看能不能小孩子可以加入这样的一个场面，但是要有一个人数限制。所以这些都是比较细节的一些问题，我们现在还在讨论。所以有详情的时候，我们会逐渐的公布。
Thank you, Ministers. We will now take the final question of today from Mindy Tan, the Business Times.
Hi, afternoon. Does the MTF expect the border closures to permanently affect the size of the foreign workforce, and will business and consumer costs go up for good? Thank you.
No, we do not expect a permanent border closure, and that's why there should not be a permanent impact on our workforce. We are, as part of our roadmap, we will be taking progressive steps, not just to ease safe management measures within our community, but also across our borders. And we are very mindful that there are affected industries, construction, marine, offshore engineering being the most affected. We are already finding different ways to bring in workers for these sectors in a safe manner. So that there's already ongoing efforts on that front. But beyond these specific projects where we are trying to bring in workers safely for these specific sectors, we are looking more broadly at reopening our borders, again synchronized with our rate of vaccination and with our reopening plans. And this will happen because our rate of our vaccination program is being accelerated. This is not, we're not talking about something that's happening, many months down the road, but we're talking about in several weeks' time, we will be able to progressively reopen our borders, allow more travel, and I think that will help with businesses who are looking for workers too.